President and founder of Healing Our Village, and Executive Director of Total Lifestyle Change. Welcome to Diabetes, the Truth About It. Is your blood sugar under good control? Do you understand the effects of diabetes on your eyes and kidneys? Are you on the correct insulin injection? Are you having trouble controlling your weight? Are you following your physician's advice? It is critical that you're using your diabetes medicines correctly. Diabetes, the Truth About It, is here to help you. Check out HOV Health to learn everything you need to know to manage your diabetes and prevent complications. Do you think you have diabetes? Normal blood sugar is 60 to 100 milligrams per deciliter. You have prediabetes if you're between 101 and 126. And we diagnose you with type 2 diabetes if your blood sugar is 126 milligrams per deciliter or greater. The symptoms of diabetes can be different for every person. Are you always thirsty and hungry? Do you urinate many times during the day, especially at night? Have you been experiencing blurred vision or not seeing things as clearly as normal? Have you been experiencing tingling or numbness in your hands and feet? Have you noticed sores in your legs and your feet that don't seem to want to heal? Are you getting vaginal or urinary tract infections more frequently? Do you have to see your dentist more often because you have more cavities? All of these may be the signs of diabetes. If you're experiencing any of these symptoms, make an appointment to see your doctor right away. Did you know that more than 86 million people in the United States have prediabetes? Prediabetes is a condition where your blood sugar level is higher than normal, but not high enough to be diagnosed with type 2 diabetes. If your blood sugar is between 101 and 126 when you wake up in the morning, you may have prediabetes. What can you do if you have prediabetes? Well, start by changing your diet and exercising 5 days per week for at least 30 minutes. There are now CDC-approved diabetes prevention programs that focus on prediabetes. Healing Our Village is one of those programs. If you live in the Los Angeles, Atlanta, or Washington, D.C. area, call 800-788-0941 and sign up for classes today. Remember, the data shows that a third of the people with prediabetes can reverse their condition. Let's talk about diabetes and high blood pressure. It's estimated that nearly 75 million Americans aged 20 and older have high blood pressure. 1 in 3 U.S. adults have high blood pressure, and of those people, we know that 77% don't even know that they have it. African Americans in the United States have the highest rate of hypertension in the world. 30% of all deaths in African American men and 20% of all deaths in African American women are due to high blood pressure. African Americans are 4 times more likely to have high blood pressure than Caucasians. In most cases, we don't know what causes high blood pressure, but the good news is it can be treated, and there are things that you can do to reduce your chances of getting high blood pressure. We know that when you have high blood pressure, it causes the blood vessels to get stiff and narrow. This makes the heart have to work harder to get the blood through your vessels. High blood pressure can also weaken the lining of the arteries and veins so that it is more susceptible to cholesterol deposits. This narrowing of the blood vessels throughout the body can lead to problems with the heart, the kidneys, the brain, and the eyes. Everyone with high blood pressure should own a blood pressure cuff. It's important that you measure your blood pressure on a regular basis to make your medications work. The goal blood pressure for patients with high blood pressure and other conditions is 130/80. However, if a patient has diabetes or kidney disease, the blood pressure goal should be less than 130/80. People with diabetes especially have to keep their blood pressure low in order to achieve protection from heart attacks and, more importantly, damage to the kidney. Thank you for watching Diabetes, the Truth About It. For more information on how to control your blood sugar, sign up for Village Club today and get your own personal diabetes coach. Go to www.hovhealth.com or call 800-788-0941. Remember, you too deserve to live a long and healthy life. Hi, thank you so much for watching Diabetes, The Truth About It. If you have any questions or comments, give us a call at 800-788-0941. If you'd like to see more videos on diabetes or other chronic diseases, go to hovhealth.com. Join us on Facebook and Instagram. We are also excited to announce our brand new mobile app called Step Up 90. It's for weight loss and diabetes prevention. Go to the website and try our 30-day free trial. If you have any questions, again, give us a call, 800-788-0941. Remember, knowledge is power. Hi, I'm Dr. Lenore Coleman, President and founder of Healing Our Village and Executive Director of Total Lifestyle Change. Welcome to Diabetes, The Truth About It. Is your blood sugar under good control? Do you understand the effects of diabetes on your eyes and kidneys? Are you on the correct insulin injection? Are you having trouble controlling your weight? Are you following your physician's advice? It is critical that you're using your diabetes medicines correctly. Diabetes, The Truth About It, is here to help you. Check out HOV Health to learn everything you need to know to manage your diabetes and prevent complications. Let's talk about the complications of diabetes, nerve damage, and sexual problems and infections. Your nerves are like telephone or electrical lines that help different parts of your body talk to each other. Diabetes quite often damages your nerves. Damage to the nerves is called neuropathy, which again is due to high blood glucose levels. When this occurs, the nerves do not send out their signals as well as before. Some of the signs of nerve damage occur in your feet and legs. You may experience numbness, a tingling sensation described as pins and needles, or you may have burning and aching. Sometimes the damage is so serious that injuries happen to your feet and your legs, and you don't even know that you've been injured. This is why uncontrolled diabetes is the leading cause of amputations. Uncontrolled diabetes can cause sexual problems through nerve damage. Men may be less likely to get or be able to keep an erection because of the damage to their nerves from high blood sugars. Women may also be less likely to have an orgasm. Your small blood vessels and nerve damage can make infections in people with diabetes occur more frequently. Poor blood flow and high blood glucose slows down the body's infection-fighting team called the white blood cells. Nerve damage prevents you from knowing when you injure yourself, so you might get a cut or a scrape that can lead to a serious skin infection if not treated quickly. The best way to treat all of these conditions, damage to the blood vessels, the nerves, sexual dysfunction, frequent infections, is to keep your blood sugar as close to normal as possible. That means getting that A1C to 7% or less. Through careful monitoring and taking your medication as prescribed, you can keep these complications to a minimum. Let's talk about the complications of diabetes. We know that people with diabetes that do not keep their blood sugar under good control can suffer from the complications of diabetes. These complications come from high blood glucose levels in the blood that causes damage to the nerves, the small and large blood vessels, and reduces the ability of your body to fight off infections. You are more likely than other people without diabetes to have problems with your eyes, your kidneys, and your feet. In addition, people with diabetes have a 2 to 5 times increased risk of heart attacks and strokes. You are also more likely to get infections and to have sexual dysfunction. Blindness can occur as a result of the disease process occurring in the eyes called retinopathy. Retinopathy is damage to the retina that's in the back of the eye. Although it occurs very slowly, eye damage is a very serious complication. In addition, damage to the small vessels of the kidneys results in nephropathy. Nephropathy is the medical term for kidney damage. The kidneys are important because they filter out the waste in the blood and pass that waste into the urine. High blood glucose and high blood pressure damage the blood vessels and the filtering ability of the kidneys. Damage to the filtering system of the kidney causes these waste products to stay in the blood. This is why people that have kidney disease, if it becomes severe, must go on dialysis. Make sure you get your eyes checked regularly by an ophthalmologist, at least once a year. Your doctor should be doing a urine test at least 2 or 3 times a year to detect the level of proteins in your urine. It is your responsibility to make sure you keep your blood sugar levels under good control so that you can prevent the complications of diabetes. Check out HOV Health to learn everything you need to know to manage your diabetes and prevent complications. Did you know that almost 29% of people stop taking their medications before they run out, and 12% don't take the medications as prescribed? Diabetes and high blood pressure are chronic or long-term illnesses that will require you to take your medication for the rest of your life. Diabetes and high blood pressure medications are designed to keep your blood sugar and your blood pressure under control. If you are not on the right combination of medications, you can end up in the hospital with a diabetes coma, a heart attack, or a stroke. Everyone with diabetes needs to know their hemoglobin A1C level and get that number below 8%. This usually requires 2 or more medications, and some people will require insulin. You should always check with your healthcare provider before stopping a medication or changing to a different one. There are some common medications used in the treatment of diabetes that actually increase your risk for low blood sugar reactions or hypoglycemia. There are some common medications for high blood pressure that can increase your risk of developing diabetes by 33%. If you're a person with diabetes or have high blood pressure, check with your pharmacist when you buy the over-the-counter medications to make sure that they will work with the medications your doctor has prescribed. Thank you for watching Diabetes, the Truth About It. For more information on how to control your blood sugar, sign up for Village Club today and get your own personal diabetes coach. Go to www.hovhealth.com or call 800-788-0941. Remember, you too deserve to live a long and healthy life. Hi, thank you so much for watching Diabetes, the Truth About It. If you have any questions or comments, give us a call at 800-788-0941. If you'd like to see more videos on diabetes or other chronic diseases, go to hovhealth.com. Join us on Facebook and Instagram. We are also excited to announce our brand new mobile app called Step Up 90. It's for weight loss and diabetes prevention. Go to the website and try our 30-day free trial. If you have any questions, again, give us a call, 800-788-0941. Remember, knowledge is power. Hi, I'm Dr. Lenore Coleman, President and founder of Healing Our Village and Executive Director of Total Lifestyle Change. Welcome to to Diabetes, the truth about it. Is your blood sugar under good control? Do you understand the effects of diabetes on your eyes and kidneys? Are you on the correct insulin injection? Are you having trouble controlling your weight? Are you following your physician's advice? It is critical that you're using your diabetes medicines correctly. Diabetes, the truth about it, is here to help you. Check out HOV Health to learn everything you need to know to manage your diabetes and prevent complications. Let's talk about diabetes and heart disease. Did you know that 68% of people age 65 or older with diabetes die from heart disease, and about 60% of them die from stroke? Did you know that adults with diabetes are 2 to 4 times more likely to die from heart disease than adults that do not have diabetes? The American Heart Association considers diabetes to be one of the 7 major controllable risk factors for cardiovascular disease. African Americans die 50% more frequently from heart disease and 80% more frequently from strokes than Caucasians. The thing about heart disease and diabetes is that even when the blood glucose is under control, you are still at risk of having a potential heart attack or stroke. The reason is that many patients with type 2 diabetes have risk factors that contribute to their heart disease. For instance, high blood pressure or hypertension is a major risk factor for cardiovascular disease, and nearly 80% of patients with diabetes also have high blood pressure. If you have both diabetes and high blood pressure, your risk for heart disease doubles. Patients with diabetes have a very high circulating level of insulin. This is called hyperinsulinemia. High insulin levels lead to insulin resistance, which affects your cholesterol levels. High cholesterol can lead to heart attacks and stroke. Thank you. Let's talk about diabetes and heart disease part 2. Did you know that 80% of people with diabetes are obese or overweight? We know that obesity is a major risk factor for heart disease and has been strongly associated with high circulating levels of insulin, which is called insulin resistance. The lack of regular exercise is a major risk factor for insulin resistance and heart disease. Exercising on a regular basis and losing weight can prevent or delay the onset of type 2 diabetes. Believe it or not, there are still people in the United States that smoke cigarettes or cigars. Smoking, whether you have diabetes or not, increases your risk for heart disease and stroke. It is important that you keep your blood sugar under tight control, and that means you need to have a hemoglobin A1C at 7% or less, and when you wake up in the morning, your blood sugar should be between 90 and 130 milligrams per deciliter. Tight control will help you, especially if you have heart disease. You can determine your cardiovascular risk score by going to the internet and putting in cvriskcalculator.com. From that calculator, you will put in all of your risk factors and it'll give you a percentage. And we hope that you are less than 10%. If your cardiovascular risk score is 10% or greater, you need to have a conversation with your doctor to determine your risk factors that you can start to eliminate to decrease your cardiovascular risk score. If you have diabetes, you need to test your blood sugar at home on a regular basis. Self-monitoring of blood sugar is critical to your understanding how the foods you eat affect your blood sugar. We know that certain foods can cause your blood sugar to spike. These are generally foods that are high in carbohydrates, like candy, ice cream, donuts, pasta, rice, potatoes, starchy vegetables, bread. If you monitor your blood sugar at least 4 to 5 times per week, first thing in the morning and after your various meals, you can make sure you are keeping your blood sugar under good control. Blood glucose monitors are easy to use and extremely accurate. There are now Bluetooth meters that can allow your healthcare team and family members to monitor your blood sugar from the cloud. For more information on remote blood glucose monitoring, contact Healing Our Village. Thank you for watching Diabetes, the Truth About It. For more information on how to control your blood sugar, sign up for Village Club today and get your own personal diabetes coach. Go to www.hovhealth.com or call 800-788-0941. Remember, you too deserve to live a long and healthy life. Hi, thank you so much for watching Diabetes, the Truth About It. If you have any questions or comments, give us a call at 800-788-0941. If you'd like to see more videos on diabetes or other chronic diseases, go to hovhealth.com. Join us on Facebook and Instagram. We are also excited to announce our brand new mobile app called Step Up 90. It's for weight loss and diabetes prevention. Go to the website and try our 30-day free trial. If you have any questions, again, give us a call, 800-788-0941. Remember, knowledge is power. Hi, I'm Dr. Lenore Coleman, President and founder of Healing Our Village and Executive Director of Total Lifestyle Change. Welcome to Diabetes, the Truth About It. Is your blood sugar under good control? Do you understand the effects of diabetes on your eyes and kidneys? Are you on the correct insulin injection? Are you having trouble controlling your weight? Are you following your physician's advice? It is critical that you're using your diabetes medicines correctly. Diabetes, the Truth About It, is here to help you. Check out HOV Health to learn everything you need to know to manage your diabetes and prevent complications. Let's talk about diabetes and exercise. When you have type 2 diabetes, physical activity is an important component of your treatment plan. Exercise makes it easier for you to control your blood sugar. Some of the common excuses why people do not exercise include, I don't have the time, I'm too old to exercise, I need special clothing to exercise, I have joint pain due to my arthritis, people at the gym will think I'm fat, I don't like to sweat. None of these excuses should you use to keep you from exercising. There are many benefits to exercising, which includes burning fat and calories. If you're doing what they call anaerobic exercise like weight training, it increases your muscle tissue, which raises your metabolic rate. Exercise has been found to reduce blood pressure, reduces your bad cholesterol, and increases your good cholesterol. It decreases your blood glucose levels and relieves your stress and maybe even depression. So here is your exercise prescription. You need to exercise at least 45 to 60 minutes per day, 5 days per week. This time can be broken up into several smaller sessions. You should include resistance training or weightlifting combined with aerobic exercise. Consider exercising after your largest meal. Walking is one of the best exercises. Get a fitness tracker so you can measure how many steps you're getting per day. The goal for steps is 1,000 steps per day. Consider doing exercise that you actually enjoy doing, like dancing, playing tennis, swimming, bike riding, hiking. Remember, including exercise in your daily routine will make a big difference in your diabetes control. Did you know that 2/3 of Americans fail to take any or all of their prescription medication? Diabetes requires you to understand the game plan, how to attack the disorder, and how to achieve victory through the use of your daily medications. Many Americans fail to get in the game and claim victory over their illness. 90 million people in the United States have difficulty understanding and using the information provided on prescription bottles, appointment slips, educational brochures, their doctor's directions, and even consent forms. Many patients are not properly educated on conditions they may have and fail to show up for their follow-up appointments. They don't even understand the instructions on the medication bottles, like take on an empty stomach. Who are the people most affected by this difficulty in understanding health care instruction? Well, it's the elderly, primarily those over 65 years of age. Immigrant and minority populations, such as African Americans, Latinos, Native Americans, and Asians. Low-income patients, approximately half of the Medicare, Medicaid recipients read below the 5th grade level, and people that have chronic mental or physical health conditions. It's important that you take your medications as prescribed. If you need help, feel free to call Healing Our Village. Let's talk about diabetes medications for type 2 diabetes. Most people with type 2 diabetes require diabetes medications to control their blood sugar. After a trial of diet and exercise, if your hemoglobin A1C is higher than normal, which is 6%, your doctor will place you on metformin as initial therapy. If after 6 months your blood sugar is not under control, there are a number of medications that can be added to your metformin. We recommend your doctor add on a medication that does not cause low blood sugar reactions. These include DPP-4 inhibitors or SGLT2 inhibitors. There are other oral agents available for the management of diabetes, but they all have their pros and cons. If you are not controlled on 2 oral medications, we recommend you consider adding on a GLP-1 inhibitor that usually comes as an injection. We recommend these agents since they have been found to decrease your appetite and help you with weight loss. If after 2 oral medications and a GLP-1 inhibitor your blood sugar is still high, we recommend you start using basal insulin in the evening. All of these medications must be taken as prescribed. It's important that these medications are increased to at least half their maximum dose. If you notice side effects, please mention it to your doctor. Remember, monitoring your blood sugar with a blood glucose monitor is an important part of your diabetes regime. We again recommend that all patients with diabetes attend a diabetes education class to learn more about their medications. Thank you for watching Diabetes, the Truth About It. For more information on how to control your blood sugar, sign up for Village Club today and get your own personal diabetes coach. Go to www.hovhealth.com or call 800-788-0941. Remember, you too deserve to live a long and healthy life. Hi, thank you so much for watching Diabetes, the Truth About It. If you have any questions or comments, give us a call at 800-788-0941. If you'd like to see more videos on diabetes or other chronic diseases, go to hovhealth.com. Join us on Facebook and Instagram. We are also excited to announce our brand new mobile app called Step Up 90. It's for weight loss and diabetes prevention. Go to the website and try our 30-day free trial. If you have any questions again, hi, I'm Dr. Lenore Coleman, President and founder of Healing Our Village and Executive Director of Total Lifestyle Change. Welcome to Diabetes, the Truth About It. Is your blood sugar under good control? Do you understand the effects of diabetes on your eyes and kidneys? Are you on the correct insulin injection? Are you having trouble controlling your weight? Are you following your physician's advice? It is critical that you're using your diabetes medicines correctly. Diabetes, the Truth About It, is here to help you. Check out HOV Health to learn everything you need to know to manage your diabetes and prevent complications. What is the skinny about diabetes and the DASH diet? Recently, U.S. News and World Report ranked the DASH diet as the best for people with diabetes. DASH stands for Dietary Approaches to Stop Hypertension. We know that many people with diabetes also have high blood pressure. We know that African Americans have the highest rate of hypertension in the world. A recent study in the American Diabetes Association Diabetes Care Journal found that people with type 2 diabetes who follow the DASH eating plan reduce their body weight and improve their blood glucose, A1C, blood pressure, and other cardiovascular risk factors. The DASH eating plan is flexible and is well balanced. The plan recommends eating fruits, vegetable, fat-free or low-fat milk and milk products, whole grain, fish, poultry, beans, seeds, and nuts. It also contains less sodium, sweets, added sugars, and sugar-containing beverages, fats, and red meats that are in the typical American diet. The DASH diet is rich in potassium, magnesium, calcium, protein, and fiber. All of these are nutrients that can help lower your blood pressure. The DASH diet recommends the use of 3 servings of fat-free or low-fat milk products a day. For African Americans with lactose intolerance, you can use lactose-free products and still get the beneficial effect. In the DASH study, African American men who followed the DASH diet were able to get a significant reduction in their blood pressure. For more information regarding the DASH diet, go to healingourvillage.com. Do you have diabetes and cannot figure out what to eat? A balanced diet will help you keep your blood glucose levels in check. Look around you. How many overweight and obese people do you see? We now have an estimated of 160 million Americans who are either obese or overweight. Nearly 75% of American men and more than 60% of American women are obese or overweight. Nearly 30% of boys and girls under age 20 are either obese or overweight. So ask yourself, what's going on? Well, I can tell you, it's fast food and the fact that we're not getting our daily exercise. We know that African Americans and Latinos have especially high numbers, mainly due to what they eat. For people with diabetes, healthy eating habits are especially important. The first step is to have your doctor refer you to a dietitian or a certified diabetes educator. Watch your portions. Eat small meals with lots of vegetables, small amounts of meat and poultry. Avoid cookies, candies, cakes, and other foods that are high in sugar. Try to drink at least 8 to 10 glasses of water per day. Try not to skip meals. Try to eat at least 2 to 3 meals a day and snacks. Never let your body get into what is called starvation mode. Try to eat your biggest meal for breakfast and lunch and have a small dinner. Consider having a soup or salad for dinner. Remember, it is still calories in, calories out. Men should eat about 1,800 to 2,000 calories per day. Women should eat about 1,200 to 1,500 calories per day. You need to start reading your food labels of everything you eat. Focus on the percentage of fat, sugar, and salt that is on the label. People with diabetes do not need to be on a special diet. Just think ahead and plan your meals with a little bit from all of the food groups. Let's talk about diabetes and exercise. When you have type 2 diabetes, physical activity is an important component of your treatment plan. Exercise makes it easier for you to control your blood sugar. Some of the common excuses why people do not exercise include, I don't have the time, I'm too old to exercise, I need special clothing to exercise, I have joint pain due to my arthritis, people at the gym will think I'm fat, I don't like to sweat. None of these excuses should you use to keep you from exercising. There are many benefits to exercising, which includes burning fat and calories. If you're doing what they call anaerobic exercise like weight training, it increases your muscle tissue, which raises your metabolic rate. Exercise has been found to reduce blood pressure, reduces your bad cholesterol, and increases your good cholesterol. It decreases your blood glucose levels and relieves your stress and maybe even depression. So here is your exercise prescription. You need to exercise at least 45 to 60 minutes per day, 5 days per week. This time can be broken up into several smaller sessions. You should include resistance training or weightlifting combined with aerobic exercise. Consider exercising after your largest meal. Walking is one of the best exercises. Get a fitness tracker so you can measure how many steps you're getting per day. The goal for steps is 1,000 steps per day. Consider doing exercise that you actually enjoy doing, like dancing, playing tennis, swimming, bike riding, hiking. Remember, including exercise in your daily routine will make a big difference in your diabetes control. Thank you for watching Diabetes, the Truth About It. For more information on how to control your blood sugar, sign up for Village Club today and get your own personal diabetes coach. Go to www.hovhealth.com or call 800-788-0941. Remember, you too deserve to live a long and healthy life. Hi, thank you so much for watching Diabetes, the Truth About It. If you have any questions or comments, give us a call at 800-788-0941. If you'd like to see more videos on diabetes or other chronic diseases, go to hovhealth.com. Join us on Facebook and Instagram. We are also excited to announce our brand new mobile app called Step Up 90. It's for weight loss and diabetes prevention. Go to the website and try our 30-day free trial. If you have any questions, again, give us a call, 800-788-0941. Remember, knowledge is power. Hi, I'm Dr. Lenore Coleman, President and founder of Healing Our Village and Executive Director of Total Lifestyle Change. Welcome to Diabetes, the Truth About It. Is your blood sugar under good control? Do you understand the effects of diabetes on your eyes and kidneys? Are you on the correct insulin injection? Are you having trouble controlling your weight? Are you following your physician's advice? It is critical that you're using your diabetes medicines correctly. Diabetes, the Truth About It, is here to help you. Check out HOV Health to learn everything you need to know to manage your diabetes and prevent complications. Let's talk about diabetes and exercise. When you have type 2 diabetes, physical activity is an important component of your treatment plan. Exercise makes it easier for you to control your blood sugar. Some of the common excuses why people do not exercise include, I don't have the time, I'm too old to exercise, I need special clothing to exercise, I have joint pain due to my arthritis, people at the gym will think I'm fat, I don't like to sweat. None of these excuses should you use to keep you from exercising. There are many benefits to exercising, which includes burning fat and calories. If you're doing what they call anaerobic exercise like weight training, it increases your muscle tissue, which raises your metabolic rate. Exercise has been found to reduce blood pressure, reduces your bad cholesterol, and increases your good cholesterol. It decreases your blood glucose levels and relieves your stress and maybe even depression. So here is your exercise prescription. You need to exercise at least 45 to 60 minutes per day, 5 days per week. This time can be broken up into several smaller sessions. You should include resistance training or weightlifting combined with aerobic exercise. Consider exercising after your largest meal. Walking is one of the best exercises. Get a fitness tracker so you can measure how many steps you're getting per day. The goal for steps is 1,000 steps per day. Consider doing exercise that you actually enjoy doing, like dancing, playing tennis, swimming, bike riding, hiking. Remember, including exercise in your daily routine will make a big difference in your diabetes control. Did you know that 2/3 of Americans fail to take any or all of their prescription medication? Diabetes requires you to understand the game plan, how to attack the disorder, and how to achieve victory through the use of your daily medications. Many Americans fail to get in the game and claim victory over their illness. 90 million people in the United States have difficulty understanding and using the information provided on prescription bottles, appointment slips, educational brochures, their doctor's directions, and even consent forms. Many patients are not properly educated on conditions they may have and fail to show up for their follow-up appointments. They don't even understand the instructions on the medication bottles, like take on an empty stomach. Who are the people most affected by this difficulty in understanding health care instruction? Well, it's the elderly, primarily those over 65 years of age. Immigrant and minority populations, such as African Americans, Latinos, Native Americans, and Asians. Low-income patients, approximately half of the Medicare, Medicaid recipients read below the 5th grade level, and people that have chronic mental or physical health conditions. It's important that you take your medications as prescribed. If you need help, feel free to call Healing Our Village. Let's talk about diabetes medications for type 2 diabetes. Most people with type 2 diabetes require diabetes medications to control their blood sugar. After a trial of diet and exercise, if your hemoglobin A1C is higher than normal, which is 6%, your doctor will place you on metformin as initial therapy. If after 6 months your blood sugar is not under control, there are a number of medications that can be added to your metformin. We recommend your doctor add on a medication that does not cause low blood sugar reactions. These include DPP-4 inhibitors or SGLT2 inhibitors. There are other oral agents available for the management of diabetes, but they all have their pros and cons. If you are not controlled on 2 oral medications, we recommend you consider adding on a GLP-1 inhibitor that usually comes as an injection. We recommend these agents since they have been found to decrease your appetite and help you with weight loss. If after 2 oral medications and a GLP-1 inhibitor your blood sugar is still high, we recommend you start using basal insulin in the evening. All of these medications must be taken as prescribed. It's important that these medications are increased to at least half their maximum dose. If you notice side effects, please mention it to your doctor. Remember, monitoring your blood sugar with a blood glucose monitor is an important part of your diabetes regime. We again recommend that all patients with diabetes attend a diabetes education class to learn more about their medications. Thank you for watching Diabetes, the Truth About It. For more information on how to control your blood sugar, sign up for Village Club today and get your own personal diabetes coach. Go to www.hovhealth.com or call 800-788-0941. Remember, you too deserve to live a long and healthy life. Hi, thank you so much for watching Diabetes, the Truth About It. If you have any questions or comments, give us a call at 800-788-0941. If you'd like to see more videos on diabetes or other chronic diseases, go to hovhealth.com. Join us on Facebook and Instagram. We are also excited to announce our brand new mobile app called Step Up 90. It's for weight loss and diabetes prevention. Go to the website and try our 30-day free trial. If you have any questions, again, give us a call, 800-788-0941. Remember, knowledge is power. Hi, I'm Dr. Lenore Coleman, President and founder of Healing Our Village and Executive Director of Total Lifestyle Change. Welcome to Diabetes, the Truth About It. Is your blood sugar under good control? Do you understand the effects of diabetes on your eyes and kidneys? Are you on the correct insulin injection? Are you having trouble controlling your weight? Are you following your physician's advice? It is critical that you're using your diabetes medicines correctly. Diabetes, the Truth About It, is here to help you. Check out HOV Health to learn everything you need to know to manage your diabetes and prevent complications. Let's talk about diabetes medications for type 1 diabetes. Most type 1 people with diabetes require insulin injections. They usually take a short-acting insulin that covers their meals and a long-acting basal insulin that provides coverage throughout the day and night. There are many different types of short-acting and long-acting insulin. They differ in their time of onset and duration. The major side effect of insulin are low blood sugar reactions, also known as hypoglycemia. Insulin can also cause you to have weight gain. It's important that you follow a scheduled eating plan if you're injecting insulin, and it's important not to skip any meals. We recommend the use of insulin pens for all patients on insulin therapy. Insulin pens virtually eliminate errors in insulin dosing. Some type 1 patients use insulin pumps to deliver their insulin. Insulin pumps are very effective and eliminate the need for insulin injections. Unfortunately, they are not covered by all insurance carriers. If you are injecting insulin, it's important to rotate your injection sites. Injecting in the same site over and over can lead to fat pads under the skin. Extra bottles or insulin pens can be kept in the refrigerator. If you keep the insulin you're using at room temperature, it will cause less skin irritation. The good news is if you follow your doctor's orders and they increase your insulin dose to match your blood sugar, you can easily control your blood sugar levels. All patients on insulin therapy must monitor their blood sugar at home with a blood glucose monitor. And we recommend that all patients, both type 1 and type 2, that have diabetes need to attend a diabetes education class to learn more about using their medications wisely. Let's talk about diabetes and foot care. The longer you have diabetes, the more blood glucose changes your body's blood vessels and nerves. The high blood glucose can actually cause damage to those vessels and nerves so that they do not work well. Over time, this can lead to foot problems. The signs of possible foot or leg problems in people with diabetes include sores on your feet or legs, sores that do not heal, an infected area that is either red, raised, or hot, feeling numbness or tingling, which is a pins and needles sensation in your feet. The numbness and tingling are signs of nerve damage. Untreated foot problems can cause gangrene, which is a serious infection that can spread to the bloodstream. Untreated gangrene may lead to amputation of the foot. It is important for you to see a foot health care professional or a podiatrist on a regular basis, at least 2 times per year. On a daily basis, you need to inspect your feet for nicks, bruises, scrapes, blisters, or sores. Make sure you check in between your toes. And if you're having difficulty seeing the bottom of your feet, use a mirror. Also check for changes in color or shape of your feet. If you do develop a sore or a blister, notify your healthcare provider immediately. Wash your feet every day, and when bathing, do not use very, very hot water or very, very cold water. Test the water with your hand before stepping into a bathtub. Dry your feet carefully, especially between the toes. Let's talk about diabetes and foot care, part 2. We know that foot care in people with diabetes is very important. Here are some helpful tips that will help you prevent problems with your feet. Always wear socks or stockings with shoes. Avoid wearing high heel or open-toed shoes. Wear only all cotton in the summer or all wool in the winter socks. Change your socks every day. Do not use hot water bottles or heating pads on your feet. If your feet are cold, wear socks. Never walk barefoot, even indoors. Make sure that your shoes fit properly. Do not wear shoes that are too tight or too loose. Shoes should be comfortable at the time of purchase. Do not depend on shoes to stretch out. It's actually best to have your feet fitted by a qualified shoe salesman who understands diabetes foot problems. Do not buy cheap shoes. And depending on your money situation, this can help you prevent from getting sores on your feet by buying quality shoes. Never wear new shoes more than 2 hours at a time. And again, inspect your feet on a regular basis for redness, blisters, or swelling. Inspect shoes for worn places or torn lining or rough areas. Do not put over-the-counter inserts into your shoes, and you should change your shoes twice a day if possible. Cut your toenails straight across and gently around the corners with an emery board. If toenails are thick, then they need to be trimmed by a podiatrist. Never remove corns or ingrown toenails or calluses yourself. Have them be removed by a qualified health care provider for the foot, which is known as a podiatrist. Have your health care provider examine your feet on a regular basis. If you're smoking, you got to stop smoking. And exercise is also important on a regular basis. If your feet hurt during exercise, stop. Thank you for watching Diabetes, the Truth. Hi, I'm Dr. Lenore Coleman, President and founder of Healing Our Village and Executive Director of Total Lifestyle Change. Welcome to Diabetes, the Truth About It. Is your blood sugar under good control? Do you understand the effects of diabetes on your eyes and kidneys? Are you on the correct insulin injection? Are you having trouble controlling your weight? Are you following your physician's advice? It is critical that you're using your diabetes medicines correctly. Diabetes, the Truth About It, is here to help you. Check out HOV Health to learn everything you need to know to manage your diabetes and prevent complications. Let's talk about diabetes and erectile dysfunction. The word impotence is used to describe emotional and physical conditions that may interfere with having sexual intercourse. People with impotence may lack the desire to have sex or have problems with orgasm or the release of semen. Sexual dysfunction in men, erectile dysfunction, is commonly seen in men with diabetes. It occurs 3 times more often than in men without diabetes. Poor control of your blood sugar can lead to erectile dysfunction. Men with diabetes can experience the symptoms of ED in their 30s. A decrease in the quality of the sperm can lead to problems with infertility. You may also notice a lack of response to visual stimulation. Sexual dysfunction in women is usually described as sexual difficulties in women that are usually seen during their late 40s. There are 4 categories of sexual dysfunction in women. Desire disorders. This is when you're not interested in having sex or have less of a desire for sex than you used to. Arousal disorders. Sometimes you may feel a sexual response in your body, or once aroused, you're not able to maintain the arousal during sexual activity. Orgasmic disorders. When you can't have an orgasm even after sufficient sexual arousal and ongoing stimulation, or you have pain during orgasm. And then sexual pain disorders, when you have pain during or after sexual stimulation or vaginal contact. For more information about erectile dysfunction and diabetes, contact Healing Our Village at 800-788-0941. Can people with type 2 diabetes drink alcohol? We recommend you check with your doctor to see if drinking alcohol is okay for you personally. We know that alcohol can raise or lower your blood sugar in some people with diabetes. We know that excessive amounts of alcohol can cause your blood sugar to drop to dangerous levels, especially in people with type 1 diabetes. Alcohol can stimulate your appetite, and many drinks are mixed with alcohol are also high in calories and can make you gain weight. When you think about alcohol, it's the same as two fat exchanges. Alcohol may increase your blood pressure and triglyceride levels. If you're going to drink alcohol, we recommend the following. Only drink if your blood sugar is under good control. Do not drink more than 2 drinks of alcohol a day if you're a man and 1 drink a day if you're a woman, and that's 4 to 8 ounces. Drink alcohol only with food and drink slowly. Avoid sugary mixed drinks, sweet wines, or cordials. And mix liquor with water, club soda, or diet soft drinks to cut the complications. Let's talk about diabetes and the ketogenic diet. How does the ketogenic diet work? Well, when you eat, your body breaks down your food to either carbohydrates, fats, or proteins. Carbohydrate is the body's primary source of energy. When following a very low carbohydrate diet, the body is forced to burn stored fat for energy. Unfortunately, your body's fat is not clean fuel. It leaves an acidic waste in your blood called ketones. Your body can get rid of some of that, but not all of the ketones, by excreting them through the urine. This process is known as nutritional ketosis. Nutritional ketosis is not the same as diabetic ketosis, which can be fatal. The blood glucose levels are also extremely high in diabetic ketosis due to insufficient insulin. Your body starts to break down fat as an energy source, and ketones build up in your blood. These ketone levels are much higher than those found with nutritional ketosis. With nutrition, blood glucose levels.
Hi, I'm Dr. Lenora Coleman, president and founder of Healing Our Village and Total Lifestyle Change. I want to welcome you here today. Merry Christmas. Happy New Year to everyone out there in the village looking at our diabetes self-management training program called Sugar Busters. As you all know, or if it's the first time you've tuned in, Sugar Busters is a 7-part series where I teach you everything you need to know about the management of diabetes, but also how you can avoid your diabetes complications that are like kidney disease, nerve disease, eye disease. All of those things are in your direct control. You can control your blood sugar. And it's very simple to do. It's very simple to do. I'll give you all of the things that you need to know for you to get your blood sugars under control on a daily basis, which then every 3 months when you check your hemoglobin A1C, that number is in the 7s, between 7 and 7.5. And for those of you who are young, who are really interested in getting that diabetes under super good control, we can get you below 7. We'd like to get you down to 6.5% hemoglobin A1C, which is the test that your doctor should be doing every 3 to 4 months. That's how you know if your diabetes is good. When you talk to my educators, first thing we're going to ask you is what's your hemoglobin A1C, because that tells us if you're in good control or you're not in good control. So a part of getting your numbers, your blood pressure number, your blood sugar number, your A1C number under good control is nutrition. Now we're about to go into the holidays, both Christmas and New Year's, and this is when all of those home-cooked meals go down. in every African American household across the country, all right? And we are going to be eating all of the things that our parents and our grandparents and our great-grandparents have eaten over the years. And most of everything is not good. Most of everything is high in fat, high in sugar, and this is a problem. Now, am I going to tell you not to eat those things on Christmas? No, I'm not. I am going to give you some ideas on how to cook it a little bit healthier so they're not so high sugar, high fat. I will talk about that. But you know, it's all about portions. So let me tell you this. Once you've gotten that first plate of food, this is what I want you to do. I want you to eat it slowly. I'm going to give you some ideas on how to cook it so that after 20, 30 minutes, you're actually full. And you don't feel the need to go back for the second plate. Okay, if we could just do that, that would be big. One serving, no seconds. Okay, all right. So today we're going to talk about nutrition, and the reason why we talk about nutrition is because we're trying to prevent obesity. Because it is the obesity that is causing your blood sugars to go up. And you get overweight because of the number of calories you're eating and the number of calories you're burning. So it's all about calories in, calories out. Calories in, calories out. And the number of calories in needs to be less, and the number of calories out needs to be more. So we're going to talk about that as we go through our Sugar Busters segment. So just for those who don't know what we talk about in Sugar Busters, this is it. This is our whole list of topics that we cover. Diabetes overview, we talk about monitoring your blood sugar at home, today's nutrition, heart disease, we talk about men's health, and coping skills. All of these are what we talk about related to the self-management of diabetes. All of these are on my YouTube channel, folks, for free. Healing Our Village Official, YouTube, they're there. And so I encourage you to go there. If you missed an episode, if you have people in your family that have diabetes, let's share the knowledge. Let's share the knowledge so that we can be able to live a long and healthy life. So important. Because the keys to successful management of your diabetes is education. The more you know, the better you do. And so it's so important that we make sure you understand healthy eating, the importance of getting your steps in, your physical exercise, what medications you need to be taking, and how to take them. And we want you to monitor your blood sugar. Everybody that has diabetes or pre-diabetes needs to own a blood pressure monitor and a blood sugar monitor. So every morning when you get up, you can test your blood sugar, or at least every other day, so we can know what your numbers are. Knowing your numbers are so critical because my educators and I can't help you if you can't tell us what your numbers are. All right? Now, what we've also added on to help you with this management of your diabetes is something called Village Club. And we're going to talk about Village Club at the end of the program. But this is a very inexpensive year membership, $72, or you can pay $8 a month to help you with this over the 12 months, and you'll have your own personal team of professionals to help you get your blood sugar under control. Now, you can't beat that. You know, I was in somebody's office the other day, and they were talking to a massage therapist, and they were trying to find their prices. You know, how much it costs for a 30-minute massage, how much it costs for an hour massage. 30-minute massage was $35, 60-minute massage was $60, and that's super cheap. Super cheap. Most massages are at the 100 to 120 range, and don't go to a resort. Then it's way more expensive. So I'm telling you that you can have your own personal health care team for $72 for the year. Who wouldn't do that? Who wouldn't do that? So sometimes you all need help, because this is complicated. Managing your diabetes is complicated. It's not easy. So I encourage you, as we talk later about Village Club, to go right up onto the website and order Village Club today, so we can give you the keys to successful management. Now, why do we want to watch what we eat? Because if you don't watch what you eat, you're going to get overweight. And our little fellow here is on the scale, looking down, and what he sees on that scale, he's not happy. He's not happy. Which means probably the needle is going up instead of down. Okay? I know about that, because I weigh every day or every other day. And when the needle goes up, I'm not happy. And it usually means I'm not on my meal plan and I'm not eating what I'm supposed to do. And so therefore, I'm gaining weight. Because remember, calories in, calories out. Why do I care about that? I care about being overweight or being obese because it causes complications. It causes stroke. It increases the risk of blood vessel damage. It increases the risk of heart attack and heart failure. It increases the risk of kidney failure. Why do I care about that? So all of these are the complications that you get if you are overweight or obese. So how do you know if you are? How do you know you're overweight? Well, you can look in the mirror. You can try on some of those clothes in your closet that used to fit that don't fit no more. Okay, so that's how you know you're gaining weight. All right, but what weight should you be at? Well, that's based upon your body mass index, BMI, your body mass index. And here is a little slide that explains to you what's considered to be normal weight. And your BMI should be between 18 and 24.9. Once you get to 25 or greater, you're considered to be overweight. And once you get to 30 or greater, you're considered to be obese. If you want to know right now, what is my BMI? It's really simple. Go to Google on your phone, your computer, type in BMI calculator, put in your height and your weight, and it's going to tell you your number. And if it's higher, 25 or higher, you're overweight. And if it's 30 or higher, you're obese. So that means I'm talking to you. And listen, this is the holidays. This is where we eat more, we drink more. This is where you decide to pull out all the sweet potato pie recipes and the red velvet cake recipes and the key lime pie and okay. This is the season that we do that. This is the season where we decide to start drinking eggnog. Okay, all of these things that we don't do usually during the year, this is the time of the year that we do this. So don't gain the next 2 weeks 10 more pounds. Okay, our goal is to stay at the weight we're at right now. We could just do that, that's a good thing. So this is a chart that your doctors have, actually. And when you go to see your doctor as a child, as an adult, they know on this chart, based upon your height and weight, what zone you're in. Are you in the overweight zone, that's yellow? Are you in the red zone, that's obese? Or are you in that green zone, which means you are at your ideal body weight? Most people are not at their ideal body weight in the United States of America. All right, 66% of this country is overweight. So please, you are in a large number of people that are having this problem. So I know for me, I'm always gonna start eating better on Monday. This is what I tell myself every week. Okay, Monday, I'm gonna do better. Okay, so I'm always waiting for tomorrow, and tomorrow always comes. But if you don't wait for tomorrow, tomorrow still comes. This is an African proverb, which means I and all of you out there have got to stop making excuses, okay, and start doing something positive, even a small step in the right direction. So every day, every week, I think about this, trying to figure out how I'm going to make a change in my body weight, because I need to lose 30 pounds. All right? Because of my hip surgeries, because I hurt my knee, because I don't like cooking. I have all sorts of reasons why this is hard for me, but I got to stop making excuses, because I got to get this thing going. So I'm trying to figure it out, and I need everybody out there to start trying to figure it out. So one of the things I'm trying to do, and I'm doing pretty good at this, is more vegetables. So I am trying to come up with recipes that I can cook that have vegetables in the recipe, so I can get my vegetables in every day. I'm trying to increase my fruits by adding that to my breakfast and my lunches. Okay, so we're going to talk more about eating right, but this picture will show you, of course, all the veggies on this picture are great for us to do, right? And having our meats to be lean and to be baked or broiled, that helps. You see the kisses down there, a little bit of hard chocolate. That's actually allowed, just a little bit, right? If your blood sugars are out of control, though, no candy. You can't have that. But if you get down to an A1C of 7% or less, then it's okay to splurge a little bit periodically. Okay, I'm going to let you do that, because if I tell you never to ever eat the things you love, then that's not going to work. Everybody's got to eat some of the things that they love. Now, this is something that's on FDA.gov. If you go to Google FDA.gov and put in My Pyramid, this thing has all sorts of information on what to eat, what are your good meats, what are your good vegetables to eat, what are your good starches to eat. It goes through everything. And so I encourage you to go and look at My Pyramid. The main thing it talks about is eating smaller portions, eating at the same time every day if you can, and try to eat earlier, before 6 o'clock if you can, and then eat the same amount every day. So don't eat like a whole lot of food one day and then nothing the next day. So that's why I am not a fan of intermittent fasting. All right, and when I went to the diabetes meeting that happened this year, the whole meeting was on intermittent fasting versus just regular meal planning, just 3 meals a day, small portions, low fat, low cal. And what those studies showed, there were just study after study after study that showed that when they looked at a group of people that were on just your regular, small portions, low fat, low cal diet, compared to the intermittent fasting group, the people on the at the 3-year mark, see, that's the trick. At 3 years, the people on low cal, low fat actually lost more weight than the people on intermittent fasting. So you need to know that. That's what the data shows. We gotta always look at the data. And the people who you're talking to have to know that data so that they're giving you accurate information. So one thing that we pride ourselves at, Healing Our Village, is if you ask us a question, we're going to give you what is called evidence-based answers. These are answers based upon the studies, the literature, the experts that are out there. That's the data that we're going to tell you. So we're not going to tell you something. And if you come back and say, well, prove it to me, Dr. Coleman, where does it say that? I'll be able to send you some information if you want to read the clinical studies, because I have all of that at my fingertips. Or I'll have the PowerPoint presentation that I saw from the meetings that I go to, from the experts that are around the country that get up every day, folks, just to make sure they know what they're talking about. Really, seriously, we have got to do better about listening to our medical experts. We're in a time right now where people think that they know more than their doctor. I don't understand where that came from. That was not what was going on 5 years ago. This is new. This is a new phenomenon, because all of a sudden we have all these internet sources what you think is accurate, and you're taking what you're reading on the internet as the real deal, as the real information. Folks, that's not true. There is so much misinformation and disinformation out there, especially about COVID, that I have never seen anything like it. So please, I'm asking you to go to sites that give you accurate information. CDC, NIH, FDA, all of those folks are the New England Journal of Medicine, PubMed. It's where all the publications are published. That's where you go if you want to get real information, all right? And of course, Healing Our Village, because we always are going by the evidence. So again, this is a pyramid from FDA.gov. Go there and you will get all sorts of information about how to eat healthy. Now here's another pyramid, and this is the pyramid that I like because I have arthritis. And so this is an anti-inflammatory diet. This is the Dr. Wheel anti-inflammatory diet. If you just type into Google Dr. Wheel anti-inflammatory diet, this pyramid's going to come up. I like it because it allows me to have a little bit of wine every day because I happen to like red wine. All right, so I'm more of a Mediterranean diet kind of person. Though I like that Mediterranean diet, low fat, low cal, and mostly a lot of vegetables in that diet, right? And it allows you to be able to have a little bit of dark chocolate. It allows you to have a little bit of red wine. And so I like that diet, all right? Also, people who live in the Mediterranean live longer than we do here in this country, right? Now, we have all sorts of reasons why we're not living longer, but part of it is what we're eating. And so that's the other reason why I like this particular diet pyramid. Now, meal planning, what does that mean? Why do we even care about meal planning? We care about meal planning because we're trying to maintain our blood glucose, decrease our blood cholesterol, and make sure that we're not eating too many calories. And so in order to be able to do that, you need to actually work with a dietitian, because that dietitian will tell you exactly how many calories you personally should be eating every day based upon your height, your weight, your physical activity, what conditions you're dealing with right now. They'll be able to tell you exactly what you specifically need to do. That's why I'm encouraging everybody to join Village Club, because you may not have a dietitian that you can ask these questions to, so you need that. Also, we have a weekly program called Diabetes Prevention, where we're starting, in the first of the year, we're going to be starting our weekly classes. We need you to tune in. We need you to tune in. If you want to know more about our DPP program, Step Up 90, you need to call our 800 number, and we'll talk about that at the end of the show. But there is a way for you to improve your health by getting optimal nutrition. And so that is why we talk about meal planning. So there's certain things you can do that are part of the meal planning. You can do the pyramid method, or you can do the plate method, or you can count your carbohydrates if you have diabetes, especially type 1 diabetes. You need to count your carbs. All right, you need to know what to do when you go to a restaurant or you're away on vacation, how you're going to continue to stay on your meal plan. You need to know what it means in terms of altering what time of the day you eat, and also what your guideline is, your guideline for alcoholic beverages. So you got to have a conversation with your doctor, but also I really think that you got to have a conversation with your dietitian. All right, now, there are certain foods that are high in calories, certain foods that are low in calories. I told you, and I will say this over and over again today, calories in, calories out. You got to know your calories. Most women are eating 1,200 to 1,500 calories a day. Most men can eat 1,800 to 2,000 calories a day. Men process their calories better than women. Women tend to store fat way more than men. So therefore, they have to eat fewer calories and definitely fewer fat calories, all right? So when you're looking at sort of substituting what you should eat and what you shouldn't eat, things that are high in calories are like your meat, your cheese, your whole milk, any fried foods, your concentrated sweets like cakes and cookies and ice creams. Things that are low in calories are your vegetables, your fruits, your peas, your beans. Foods that are high in water content, or like a watermelon, for instance. You can't eat a lot of it, but it's high in water content. Foods that are high in water content or fiber content, those foods are lower in calories. And whole grains. All of those is what you're supposed to be substituting into your diet, which means whenever you buy something and put it into your cart, you need to turn it over and look at the label. And we're going to talk about reading food labels a little bit later. So, in terms of guidelines for healthy eating, we want you to roast and bake and grill your food. We want you to avoid fried foods. We want you to eat fewer high-fat foods, like what we just mentioned, including nuts and salad dressing and solid shortenings. All of those are high-fat. Bacon, sausage, hot dogs, butter, all of that, high-fat. Now, in this chart, the main thing to take away is think about getting non-stick cookware. I know I went and I changed all my cookware. So now I can just spray some cooking spray on it and nothing sticks. So I don't have to use butter. I don't have to use salad oil. If I do have to use oil, I use canola oil, and we'll talk some more about that. But that's the most important thing from this slide. Now, let's talk about each of the individual things that you eat in your foods. Okay, so there's carbohydrates. Carbohydrates are important. They are what give you energy. Those are your simple sugars, your complex carbohydrates, which is your starches. All right, and these carbohydrates is when you eat them, especially if you have diabetes, that's what's making your blood sugar go up. It's the carbs. So you have to watch your carbs. So carbohydrates, proteins, fats are all calculated in grams. So you're not supposed to have more than about 50 grams of carbohydrate per meal as a person with diabetes. So you have to, again, read the labels and add it up for every meal to be able to make sure you're not exceeding that. And maybe if you're really trying to lose weight, you need to be down somewhere around 40 grams of carbohydrate per meal. Now, simple sugars, that's listed here. So that's your sugar, that's your candy, that's your honey, your corn syrup, all right? All of those are considered to be simple sugars. They go into your body fast. That's why when we tell you about should I drink orange juice or should I have an orange, the answer to that question is orange. You want to avoid juices, all right? We want to avoid drinking your sugars. In fact, everything you drink should be 0 calories, 0 sugars. So go right now, look in your refrigerator during the break, look at the bottles that are in there, the cartons that are in there, and see how much sugar is in what you're drinking, because we want you to not drink your calories. Very important. Now, in terms of why we think about this complex carbohydrates versus simple carbohydrates, simple sugars, we know that complex carbohydrates are better than simple carbohydrates, and the reason why is it fills you up more. Okay, it takes more energy for your body to digest it. The harder your body has to work to digest something, the less calories it is, because you're burning calories for that particular food that you've eaten. It also, for those with diabetes, improves the sensitivity of your circulating insulin in your body. So your circulating insulin works better, because as we remember from our first episode called What You Need to Know About Diabetes, it's your insulin from your pancreas that helps get the sugar out of your blood into your cells. So we want that insulin to be super sensitive so that it works accurately. Okay. So what is a complex carbohydrate? We told you what a simple carbohydrate was, right? That was your juices, that was your honey, that was your sugar, all of those things. Your complex carbohydrates are these: your peas, your pasta, your breads, your cereals. All right, all of those are high in fiber. Because they're high in fiber, takes your energy for your body to digest it, and so it's not going to spike your sugar as high. You want to avoid the spikes. It is the spikes in your blood sugar that damage your eyes. It is the spikes in your blood sugar that damages your heart. You want to avoid the spikes. It's the spikes that damage your kidney. So what we're trying to do is keep our blood sugars nice and even all day long. That's our goal. All right? And if it goes up just a little bit, but it doesn't go up high because that's considered a spike and that's not good. Okay? Now, let's talk about protein. Everybody has to have protein because protein helps build and rebuild the muscles in your body, plus it helps with certain enzyme systems in your body, all right? So it needs to be only about 15% of your total calories, or about 75 grams. So when you're looking at 3 meals a day, you're dividing that 75 across those 3 meals, or in maybe 2 of your meals, because maybe you only eat grains. Like I eat cereal in the morning with some low-fat milk. That's what I eat. And I have a little bit of fruit because I got to get my fruit in. So that's what I do. I throw some fruit on top of this cereal, okay? So then I'm spreading out my protein on my lunch and my dinner. So I'm dividing that 75 grams in half for my lunch and my dinner. Okay, that's what I'm trying to do at this stage of the game. So that's about 2 to 3 servings or 8 ounces of non-fat dairy, because milk is considered a protein as well, right? So when I'm looking at my protein, my cereal in the morning has a little bit of milk, so I'm getting a little bit of protein. So I am counting that as part of my 75 grams. So I want you to see the difference in the calories between whole milk, 150 calories, and skim milk, 90 calories. So I use 1%. And that's the milk, and that's what I drink. If I drink milk, which I do, because milk is good for your bones. And milk is fortified with calcium. So that is why now if you're one of the African Americans that can't tolerate milk, then that's okay. You just have to get yourself a lactose-free milk so that you can still drink and get your protein in the morning if you're eating cereal, all right, or throughout the day. And for those smoothie drinkers, you know, if you want to get that creamy smoothie, pour a little bit of milk in there. And that really makes that smoothie really, really creamy. You'll love it. Trust me, just a little bit of milk. So what I usually do is I get the water and I put a little bit of milk in that water and I throw that in my blender, all right, along with my protein powder. So if you're too busy in the morning to actually eat, then make yourself a smoothie real quick and get out the door. Now, fat, let's talk about that. We know that fat makes you fat. We need to decrease our fat intake to about 30%, all right? And we should try to not eat saturated fat, all right? So saturated fats are easy to tell what those are. Anything that's solid. Any fat that's solid, butters, anything that's solid is a saturated fat. When you're looking for liquid fats, canola oils, your oils, those are what you're supposed to be doing, all right? Trying to use monounsaturated fats for your fat intake. That is why I like the Mediterranean diet, because the oils that they use for the Mediterranean diet tend to be monounsaturated fats. They're using canola, they're using olive oil. All of those are good oils to use. Now, when you go out and you buy your meats, we always pick the meat that has the nice, what they call marbling. Well, marbling is fat. Okay, so just remember that. That's why grilling it is a good idea, because then that fat drips down into the coals or into the grill bed, and so that's why you're doing better. So foods that are high in saturated fat are your meat, your lard, your butter, your whole milk, your coconut oil. A lot of people all of a sudden decided they're going to start drinking coconut oil or using coconut oil, okay, or using coconut milk. No, okay. Not if you're trying to lose weight, folks. That is not what you need to be doing, all right? So we're going to stop here, take a real short break. I want you to go to your refrigerator, look at those cartons and those bottles in there and see how many calories you're drinking in 8 ounces. And it will knock your socks off. No more than 5 calories, folks. Just go look at what you got in your freezer, and we'll be right back.
epigallocatechin gallate, superoxide dismutase, glutathione peroxidase. Now, those are names you probably aren't familiar with, but you should be. Those are antioxidants known to fight free radicals. In fact, did you know that some viruses are actually alcohol resistant? One major study showed that by adding the epigallocatechins from green tea, it killed the virus on contact. Please allow me to introduce myself. My name is Mark Johnson. I'm here to share with you an exciting new, technologically advanced, patent-pending green tea hand sanitizing wash from Handout Protection. Now, this is not your typical hand gel designed to just smear all over your hand. This is a hand washing sanitizer to cover your entire hand, both the front and back of your hand, in between your fingers and your wrist. This is a non-sticky sanitizing hand wash designed for convenience to take with you in your purse, pocket, or carry in your lunchbox. As Dr. Josh Ridge has stated, what goes on your body goes into your body. That is why we choose only the highest FDA-compliant ingredients, such as 75% isopropyl alcohol, an organic green tea brewed with alkaline water. The only way to protect yourself and your family is to always carry a disposable package of Handout with you. This may be the only handout you ever need.
Hey, welcome back. This is our Sugar Buster series. I'm Dr. Lenore Coleman. We're talking about nutrition. We're talking about what we're going to do over these next couple of weeks. This is the end of the year. 2022 is almost out of here. 2023 is coming. So I'm trying to get you all for the next 2 weeks to not gain any weight. That's what we're trying to do. Just trying to not gain. If we can do that, we'll be doing great. So we're talking about fats. So let's look at some pictures of some test tubes and from the various different things. Simple, all right? Okay, when you look at these, you can see that coconut oil, remember I told you, no coconut oil, all right, is a lot more than you're looking at in palm oil, all right? You see that chocolate you love so much? You see that white line? You see how much fat it has in it? Yeah. That's why you can have a little bit, but you can't have a lot. All right? We want you to use these monounsaturated fats. Remember I told you monounsaturated. That's what we want to do. So change out all the oils in your house, folks. Just do it. Just throw them away. Give it to your family who doesn't have diabetes or isn't overweight. Let them use all that other stuff. You're using olive oil, canola oil, or peanut oils. Okay? Again, you can tell if an oil is not a good oil because if it's solid, when you put it in the refrigerator, if it gets solid, that's not good. That's not good. So you want things that stay liquid, even though they're in a refrigerator. All right, that's how you can tell. We do know that these monounsaturated fats help you lower your cholesterol, helps you increase your good cholesterol, your HDL, so they're important. All right, so here's the oils. So I can show you with a picture. There's your olive. There's your canola. You see how you can hardly see any fat in that canola oil. There's your peanut. So these are the good oils that we want you to be using. Now, polyunsaturated fats, you can have some of those. Those are your fish oils. So if you're eating a lot of fish, you're actually eating polyunsaturated fats. But they have omega-3 and omega-6 fatty acids in it. That's good because we know omega-3 and omega-6 lowers your bad cholesterol, your LDL, but it also lowers your HDL, your good cholesterol. So that's why we don't want you to eat a whole lot of that. And if you have a cholesterol problem, too much of these polyunsaturated fats can be harmful. So here's pictures of that. So you got your corn, you got your soybean, you got your wheat germ, you got your safflower oil. All of those are pretty good, but they're definitely better than the saturated fats, but not as good as those monounsaturated. Now, we also want you to get
oleic acid. Oleic acid is an important ingredient in your diet to keep you healthy, and it's in these oils. It's in olive oil, peanut oil, pecan oil, soybean oil. All those oils that I've been just talking about, those actually work very well. Now, all of you folks out there who use salt at your dinner table, I'm talking to you. You need to take that salt shaker off your dinner table. You are not anymore, after today, going to salt your food. You're not going to even cook with salt. You're going to try to avoid salt because most African Americans that I'm talking to out there, you guys have high blood pressure. High blood pressure, salt is bad for your high blood pressure. So it's very, very, very important that we decrease our salt. Most Americans are consuming 8 to 12 grams of salt a day because we're eating all these processed foods, canned foods, fast foods especially. The reason why those French fries stay okay sitting there for hours is because of all the processing and all the salt that's in those fries. And then they actually sprinkle some more salt on them, okay? All right, you're only supposed to have 1 teaspoon of salt a day. That 1 teaspoon is equal to 2,400 milligrams of salt, milligrams. All right, so again, if you read your food labels, you're going to get to 2,400 real quick. So you need to look at your labels to see how much salt is in what you're eating. The way you reduce your salt intake is don't cook with it, don't put it on at the table, that's really important, and try to avoid salty foods like lunch meats and chips and salt pork and ham hocks. Hello, you greens eating people out there. You about to put this salt pork and this ham hocks and these greens. Yes, you are. All right, so you got to put turkey in there. We got 2 holidays coming up, and you know you're going to be cooking that stuff, so you got to figure out a different way to season it. All right, dill pickles, canned foods, all of those things are high in salt. You can reduce it by eating more raw and fresh foods. Avoid chips and salted nuts. Whew. And if you want to buy something that you like, look for the label of that item that says low salt or low sodium. Then if you've got to have that thing, look for those if they're available and buy those instead. So then you still get to eat what you like, but you're getting a less salt from that particular product, okay? So again, cheeses, soups, TV dinners, and then all of your seasonings that say salt. So seasoning salt, onion salt, garlic salt, all of those are salt. So you need to be cooking with onion powder, garlic powder, and all of the herbs and spices that are out there. They don't have salt. So as you're cooking these meals over the next 2 weeks, I want you to think about this because you're cooking for people in your family, all of which may not be healthy, may have heart conditions or kidney conditions or high blood pressure. So you cooks out there, I'm holding you responsible for cooking healthy over the next 2 weeks for these dinners that you're cooking out there. All right? Again, more vegetables, raw and cooked, more whole fruit instead of fruit juice, more foods high in fiber, that like a brown rice or wild rice. For those of you who are cooking rice for that dinner, instead of white rice, you should be cooking these more fibrous types of starches. Now, here's an example of an 1,800 calorie diet versus a 1,500 calorie diet, right? And so this just kind of gives you a difference between 1,500 versus 1,800. And you can see they're very similar, except for, they're just kind of substituting a little bit of what you're wanting to eat. But what you can take from this slide is poultry and fish is good. Salmon and tuna is good. Fish fillets are good. Whole chicken, the breast, is better than the dark meat. So all of these little tiny things, you can have a hamburger, but it has to be small. All right, and now they have these sort of meatless hamburgers, which are really good. I don't know if you've tried them. They're expensive, but it tastes just like a hamburger. And so that's what I've been doing if I get one of my urges to have a hamburger.
Here's my fruits on top of my cereal. You see, that's how I'm getting my fruits in. So I'm aiming for 5 fruits and vegetables a day, and that's how I do it. I try to do fruits at every meal and as snacks so I can get my 5 in, all right? So yeah, this the way you arrive at 5 is by adding the carrots to your salads, or adding some raisins to your cereals or to your salads, or mixing it up. Last night I had, what I'm trying to do is eat soup at night instead of dinner. So I'm trying to eat my biggest meal in the middle of the day, and then after 6, I only eat soup. So I got some butternut squash soup. I like butternut squash soup. So I got some butternut squash soup, and I put a few pecans, chopped up, few pecans. I threw in some chopped up broccoli. Okay, so I get my vegetables in there. Put a little bit of cheese, just a little bit, right? And it was really good. So I take these soups and I just start throwing a bunch of stuff in there. And that's how I get my arrive at 5. So that's been working pretty good. And I recommend you guys give that a try. If you like soup, that's a good way to get it done. So again, trying to use your fruits maybe for dessert, right? With a little bit of whipped cream on top maybe to juice it up a little bit. All of these are ways to be able to arrive at 5. As I said, I'm really pushing Village Club so you can talk to a dietitian, because everyone that has diabetes, kidney disease, heart disease needs to talk to a dietitian so that they can tell you what food you can and cannot have. All right? Here's the food label that I promised that we'd talk about. So every product that you eat, everything you buy has a nutrition label on there. And if you look at that label, you'll see how many calories is in that particular thing you're about to eat, and how many servings anything you're about to eat, and how many calories per serving. So that means if you eat the whole thing, you got to multiply the number of servings by the number of calories per serving, and then you know how much that is. Remembering that if you're a woman, you're at 1,200 to 1,500 calories, and if you're a man, you're at 1,800 to 2,000 calories, all right? But these labels also tell you how much sodium. You see, it sees how much sodium. This particular item has 35 milligrams. Remember, I told you you could have 2,400 milligrams. So if you eat this, you're getting 35 of that, 2,400. You see? You see, it says total carbohydrates. Remember, I told you should be around 40 to 50 grams of carbohydrates. So if you eat a serving of this, it gives you 6 grams. All right, a serving of this frozen carrots is a half a cup. In this bag of carrots, there are 5 servings. So that's when you start multiplying these numbers, right? Okay. How much sugar? You see, 3 grams of sugar, 1 gram of protein. There's not that much protein in carrots. All right, it has no fat. Carrots don't have any fat. So this is what you're going to start doing with the things that you're eating to help you get to where you need to be in terms of how much protein, how much carbohydrate, and how much fat you're eating per meal. And then 3 meals, that gives you how much you're doing per day. Got it? Okay, now, calories in, calories out. All of it has to do with portions. You can pretty much eat everything, but you just have to eat smaller amounts of things that are high in calories. You have to eat just a little bit. You can eat a lot more of things that are low in calories. That's all you have to think about. This stuff is pretty simple. So instead of filling up your plate, you're going to really decrease your portion sizes. Start, measuring what a half a cup is, measuring what a cup is. So therefore, once you've measured it once, you don't have to measure it again. You know exactly how much it is. And so when you're dishing up these various things and you're only supposed to have a half a cup of it, then you'll know what that looks like. You got to learn how to substitute. So regular chips, you want to substitute maybe popcorn or pretzels. But pretzels have a lot of salt. So if you have cardiovascular disease, you want to avoid that. See, so all of that is what you're looking at.
Instead of regular milk, 1% milk. Instead of regular cheese, you're eating low-fat cheese. Instead of ham hocks and fatback, you're doing turkey thighs. Instead of pork bacon, you're getting you're eating the turkey bacon or lean bacon. I don't know if you've ever tried that, but those things are pretty good. All right, so these are how you're changing things out to be less fat, less calories. And so if you put your mind to this whole thing, it's not that hard. It's not that hard. Alcohol is a depressant. People who are alcoholics are trying to not be depressed, so they drink, but drinking actually makes you more depressed. All right, but it also is a sugar, so it increases your blood sugar. So that's why you always have to talk about how much alcohol you can have with your doctor. If your doctor allows you to have a half a cup of wine with your dinner, that's a discussion that you need to have with them, right? But remember, you need to avoid sweet wines, liqueurs, mixed drinks, things that are made from sugar cane, like rum. I don't know if you guys know that. It's made from sugar. So that's a problem. All right, where vodka is made from grains. So if you got to have a difference between vodka and rum and you have diabetes, it's better to drink vodka than it is to drink rum. Trust me, all right? These are the kinds of things you have to think about in terms of what you're doing, especially during the holidays, because this is a time where people tend to drink a little bit more. So when you're thinking about sort of what alcohol is a fat. And if you're drinking a wine, then it's a fat and a fruit. So you have to add that. If you're doing one of those exchange diets, then you need to take that into consideration. This slide is an important slide. I wrestle with this because I tell myself all sorts of things to make me feel better, okay? But I really have stopped lying to myself, right? Because I know what to do. I know what to do. It's not that I don't know what to do. It's just I don't want to do what I know what to do. So you can tell everybody else a lie, but you know that you're eating too much. And you know you're eating too much because you look in the mirror. Now, some of you don't have no mirrors in your house. You need to get some mirrors in your house. Yeah, in your bedroom. You need to look at yourself. Because that way you can stop lying to yourself. You know that you didn't used to look like that 20 years ago. Yeah. So you know that. So once you've gotten this out of the way, then you can start making these small changes to your eating habits that'll help you start getting that scale to go down instead of up. I like to snack. I'm a snacker. So I have to figure out what I can snack on. And like I said, fruit is one of the things that I use. Strawberries, blueberries, boysenberry, I love all berries. Cantaloupe, all right, low calorie. Strawberries, low calorie. So that's what I do. If I really kind of have a craving, I'll get some low calorie bread, I'll toast it, and then I'll put just a little bit of peanut butter on there. A little bit of peanut butter. And that is a nice snack for me. So that's what I usually do. There are some snacks you can purchase at the grocery store that say 100 calories. Your snacks should be right about 100 calories, and you can have 3 snacks a day. So to burn 100 calories, this is what you have to do. You have to bicycle for 10 minutes or do aerobics for 12 minutes or dancing for 18 minutes. So again, calories in, calories out. So if I eat 100 calories and I do something that burns 100 calories and I'm net zero, so that works. You can do that, but you got to keep track. You got to keep track. So at this point, we are done with our Sugar Busters nutrition segment. I hope that was helpful. If you have any questions, you can always give us a call at 800-788-0941. We're here in Jonesboro, Georgia, right here on Main Street, 177 North Main Street. Subscribe to our website, like our Facebook, become one of our community. Instagram, Facebook, we're sending out recipes. We're sending out information that you need to know about diabetes. I have a website, HOVhealth.com. I have Healing Our Village Official. I got videos up there, free. All you just have to watch them, right? So it's really important that I get you all to start learning more about what you need to do to live a long and healthy life.
We have a weight loss program called Step Up 90. It's an app on your phone. It's the coolest thing ever. And we'd love you all to sign up for Step Up 90. Again, you'll get your own personalized coach that's there for you. They'll be calling and talking to you weekly for the first 6 months to kind of get you going so you can lose that 10% of your body weight. There's recipes up there. It is the coolest app ever. For more information, you gotta call Healing Our Village or go to the Step Up 90 website, stepup90.com. It has all the information that you need to know. I want you to know your numbers. Remember, I tell you gotta check your blood sugar. You gotta take your blood pressure. We sell blood pressure cuffs. We sell blood glucose monitors. Just go to our Healing Our Village, HOVhealth.com website, go to our store and order, and we'll ship it out to you. Or direct you to a local pharmacy in your area that you can go get it and pick it up after you've paid for it. So we really are very interested in working with you to help you know your numbers. Here in Jonesboro at 177 North Main Street, we do Wellness Wednesdays, where if you walk in, we will take your blood pressure. If you walk in, we will take your blood sugar. If you don't know your COVID-19 status, we're about to start gathering for Christmas, Christmas Eve, Christmas dinner, New Year's Eve, New Year's Day. So we can eat our red beans and rice, we can eat our black-eyed peas and our gumbo. Before you walk in, everyone in your family needs to have a COVID test. You need to know you're negative. And then everybody can hug and have fun and be close and not worry about spreading COVID, folks. If you need a COVID test, we have them here. All right, the government's actually sending out more free tests. So there is no excuse for you to not know your COVID status. Let's get it done so we can stay healthy, because the COVID variants are here in Georgia, which is where I live, and it's cold outside, and the COVID virus likes the cold. So I am worried about this holiday. You do not want to go into 2023 sick. Trust and believe. And we have variants, new variants, here in Georgia. They call them Scrabble variants. So we got to test over the holidays, folks. If you don't know exactly what to do, call our 800 number, 800-788-0941. We're here. We're here to help you. Just call. I have healthcare professionals that'll call you back, let you know what you need to do. Stop by and visit us. All right, it's so important. If you don't know about COVID, you're not sure, go to my nonprofit website, tlc-global.org. I got a whole page full of nothing but COVID information that we're trying to share with you for you to be able to, again, live a long and healthy life. Village Club, I want you to join. $72 for the year. If you want to pay monthly, it's $8 a month. It's 26 cents a day. 26 cents a day. And you have your own personal healthcare team. I don't get it. I don't understand why you wouldn't want to do that immediately so you can live a long and healthy life. Thank you for tuning in for Sugar Busters. Please let everybody know I'm here on Saturdays 12 to 1, streaming Sugar Busters. Anybody in your family that has diabetes, anybody in your family that's overweight, they need to be watching this so that we can make sure that we walk into 2023 on the right track. Thanks again for tuning in today, and we'll hopefully see you next week.
Hello, I'm Dr. Lenora Coleman, President and founder of Healing Our Village. Did you know 88 million people in the United States have prediabetes, and that number keeps growing? Did you know that more than 2 in 3 adults in the United States are either overweight or obese? Healing Our Village is excited to introduce Step Up 90, weight loss and diabetes prevention program, all in one. Finally, there is a guided mobile app that will help you lose 5 to 7% of your body weight and help you get your 150 minutes of exercise in every week. All of this is available on your cell phone, notepad, or computer. To install Step Up 90, All you have to do is go to www.stepup90 from your phone or computer and hit the install button. Once the icon is added to your home screen, you can create a unique login and password or use your Facebook or Google login credentials. Do you have prediabetes? Does diabetes run in your family? Well, once you log in to StepUp90, you can take the diabetes risk test. If you score more than 5, you may be at risk of developing type 2 diabetes. StepUp90 features the CDC-approved Prevent T2 program, along with their food log, fitness log, and action plan. All materials can be printed or downloaded for easy use. Our monthly calendar provides our virtual class schedule with a reminder 30 minutes before the class to help you remember. Are you looking for easy to understand lifestyle videos, healthy recipes, exercise classes, nutritional support groups, or a cooking demonstration? All of this is available with our premium package. The most unique feature of StepUp90 is your ability to chat with your lifestyle coach, a clinical pharmacist, or a registered dietitian. These experts will have weekly office hours. They are there to help you achieve your lifestyle goals and manage your medications. Sign up today for StepUp90. We have our basic package starting at $5.99, featuring our weekly Zoom classes, and our premium package at $19.99. StepUp90, it is time for you to step up.